Marijuana, also known as cannabis, affects both the brain and body in various ways due to its active compounds, primarily tetrahydrocannabinol, THC, and cannabidiol, CBD. Here is a detailed overview of its effects. Effects on the brain. 1. Psychoactive effects. Euphoria. THC induces a feeling of euphoria or high by activating the brain's reward system and increasing the release of dopamine. Altered perception. Users often experience changes in sensory perception and a distorted sense of time. Cognitive function. THC can impair short-term memory, attention, and coordination. Heavy or chronic use can lead to long-term cognitive deficits, especially in adolescents whose brains are still developing. Anxiety and paranoia. High doses of THC can induce anxiety, paranoia, or even panic attacks in some individuals. 2. Neurotransmitter interaction. THC mimics anandamide, a naturally occurring neurotransmitter, binding to cannabinoid receptors in the brain, affecting memory, pleasure, concentration, and movement. CBD. Unlike THC, CBD does not have psychoactive effects and can counteract some of THC's negative effects, such as anxiety and paranoia. 3. Potential for dependence. Regular use can lead to tolerance, needing more to achieve the same effects, and, in some cases, dependence. Withdrawal symptoms may include irritability, insomnia, and decreased appetite. Effects on the body. 1. Respiratory system. Smoking risks. Smoking marijuana can irritate the lungs, leading to bronchitis-like symptoms. Long-term smoking may harm lung health, though the risk of cancer appears lower than with tobacco. Vaporization and edibles. These methods may mitigate some respiratory risks, but come with their own set of challenges, such as dosage control. 2. Cardiovascular system. Heart rate. THC can increase heart rate, which may pose risks for individuals with heart conditions. The effects are temporary, but can be concerning for those with underlying heart issues. Blood pressure. Blood pressure may increase or decrease depending on the user's posture and overall health condition. 3. Digestive system. Appetite. THC is known to increase appetite, commonly referred to as the munchies, which can be beneficial for patients needing to gain weight, such as those undergoing chemotherapy. Nausea and vomiting. Cannabis can reduce nausea and vomiting, making it useful for patients with these symptoms from chemotherapy or other treatments. 4. Immune system. The effects of marijuana on the immune system are still being studied. Some research suggests it can have immunosuppressive effects, potentially affecting the body's ability to fight infections. Medical uses. Marijuana is used for various medical purposes, including chronic pain relief, effective for some chronic pain conditions, reducing reliance on opioids. Seizure disorders. Particularly CBD is effective in reducing the frequency of seizures in conditions like epilepsy. Mental health. CBD shows promise in treating anxiety, PTSD, and depression, though more research is needed. Risks and considerations. Adolescence. The adolescent brain is particularly vulnerable to the effects of marijuana, with potential long-term impacts on cognitive development and mental health. Mental health. While marijuana can alleviate symptoms of some mental health disorders, it may exacerbate conditions like schizophrenia or trigger psychosis in predisposed individuals. Pregnancy. Using marijuana during pregnancy can affect fetal brain development, leading to cognitive and behavioral issues in children. Conclusion. Marijuana has a complex profile of effects on the brain and body with both potential benefits and risks. Its impact varies based on the individual's biology, the amount and frequency of use, and the method of consumption. Responsible use and further research are essential to fully understand and harness its